ADONAI Studios, in partnership with Dorcas Margaret Foundation, presents.
This kind of disability is very, very challenging, so traumatizing, so disturbing, so frustrating, and as a mother, you need to be alert.
The embarrassment with urine stool, it has been consistent and rampant from childhood to now. Every time, it's like every day you should expect that you would be disgraced or something, and the misery and then the emotional stress, the psychological traumas in it alone is troubling.
Education on Spina Bifida and Hydrocephalus. This film is dedicated to the memory of the late Miss Dorcas Margaret Madjikie, who until 15 November 2022 was Ghana's oldest person with Spina Bifida and Hydrocephalus. Warning: this film contains some disturbing images and narrations. Viewer discretion is advised.
Spina bifida is the defect in the neural tube. The neural tube is in the beginning of pregnancy. There is a tube which has to be formed, but before the tube is formed, there is a plate called neural plate, and then this plate has to fold over to form a tube. And when there is a defect in the formation of the tube, that is what brings about spinal bifida or neural tube defects. So in effect, I would say neural tube defect is a defect in the formation of the early brain and spinal cord and the spine of a child.
Nana Brown Akwe, neuroscience specialist, Kolebu Teaching Hospital, speaking.
But then hydrocephalus is accumulation of excess fluid in the brain, a fluid called CSF, cerebrospinal fluid. When there is excess accumulation of it, we have hydrocephalus. It can be a complication of spinal bifida.
Doctors say there is no specific cause of spina bifida and hydrocephalus, but there are predisposing factors.
The factors can be genetic. When you have children with such conditions in your family, your risk of having one is high. Another risk factor can be maternal infections. If a woman is pregnant, then you have infections such as toxoplasmosis, cytomegalovirus, HIV/AIDS, herpes, lots of infections, then you can have a child with hydrocephalus. And then there is also poorly controlled diabetes. If you have high sugars during pregnancy, this can also affect the child. And then there is also trauma. When I say trauma, I mean injury to the head. When the child comes out, there is injury to the head. You hit your head against something, you bleed into your brain, you can have hydrocephalus. If you don't have enough folate in your food, i.e. folic acid in the synthetic form, then you can also have a child with spinal bifida. One of the factors can be a malformation of the brain or the neural tube, as said earlier. And then some infections like meningitis can also bring along hydrocephalus. And then drugs. If you are on anticonvulsants, if you are an epileptic and you are pregnant, your medication can also interact with the formation of the neural tube of the child. So you can also have a child with spinal bifida. And then some lesions or tumors can also bring about hydrocephalus. And hydrocephalus doesn't affect only children, it can affect both children and adults.
Even though it is possible for a child to be born with either spina bifida or hydrocephalus alone, oftentimes the two come together.
It is possible for a child to have one. Normally, it is documented that 50% of children with spinal bifida have hydrocephalus because the brain is continuous with the spinal cord. And then when you have spinal bifida, the brain pulls down. And then this pulling down of the brain obstructs the flow of CSF in the brain. So you have hydrocephalus. But then there are some who just have purely hydrocephalus. The majority has.
Very little is known about spina bifida and hydrocephalus in Ghana. The low or rather no knowledge about the condition in the country has resulted in victims and their families suffering in silence without any support. Complications associated with the condition makes it very difficult to live with, just as it is very expensive to manage.
The pains Dorcas was going through was unbearable.
Dr. Mrs. Joyce Madjitey, mother of late Dorcas Madjitey, speaking.
Now, she couldn't urinate on her own because some of the urine will come out, but the rest of the urine was not coming out, and it was staying in the 2 kidneys. That was why the kidneys were swelling. So at Kolebu, the other thing that they asked us to do was for her to wear a catheter. So she permanently started wearing the catheter. And the process of inserting the catheter itself was a big challenge. And after 3 to 4 weeks, the catheter had to be changed. And so that process of monthly changing of catheter was another traumatic situation for her. And along the way, the catheter would also block. And immediately it blocks, it gives a pain around her lower abdomen. And you quickly have to change the catheter. So always changing catheter, always experiencing waist pains, always having challenges even with the shunt in the head, right through the neck to her lower abdomen. So every part of her body was aching.
With the hydrocephalus, we put a tube in. Remember I said it's accumulation of fluid. So we surgically put a tube in to divert the flow. So the flow of the fluid will bypass where the obstruction is and then go into your tummy, then you wee out. So there's no total treatment, but it's just managed. This tube is a foreign body, so anything can happen to the tube. It can get infected, it can get blocked, it can even migrate from the abdomen to another place, or sometimes from the head to another place. It can overdrain. We are draining fluid, it can overdrain and then it can also underdrain. So a lot of things go in when you have this tube in your head. It can even break. So when all this happens, then the tube is not going to function. You have to come back. So when you have this tube, you have it forever. You have to come back for us to either put in more, change it for you, or intervene for you to be okay. And then with the spinal bifida is also surgery. You repair the place. The defect is such that when there's a defect at the back of your spine, your nerves comes through the spine. You see a swelling behind the child. The nerves are in, there's some water in there, and then sometimes the cord, the spinal cord is continuous with the brain. It also comes into the sac behind the child. So when we come, we repair it. We cut it off, the place becomes flat. But then the nerves were supposed to go into your legs for your legs to function. So once that thing is cut off, it means your leg cannot function. You have weakness, or some people even have paralysis. And then these nerves, depending on the location of the swelling, some of the nerves also go to your bladder and your bowel, where what tells you to poo and what tells you to pee. So when these nerves are also repaired at your back, it means those sensations are not going. So you are going to have incontinence. When you want to pee, you can't tell. You just wet yourself. And then when you want to poo, you can't tell. You also poo on yourselves.
Having to deal with this whole urine and stool in classes, I remember there was a time I went to class and I don't know what happened, but then the stool just came out and I was sitting by somebody and I was so embarrassed that I didn't know what to do. I couldn't get up, I could not do anything. The stench was so bad. And I had 2 friends who tried to help me, even with that. The harm had already been caused because my friends the whole place was smelling, and I knew it was me, and I knew they knew it was me. I mean, the embarrassment with urine stool that has been consistent and rampant from childhood to now. Every time, like, it's like every day you should expect that you would be, disgraced or something, and having to deal with this, the misery, and then the emotional stress, the psychological traumas in it alone is troubling.
Late Dorcas Margaret Madjikie, victim of Spina Bifida and Hydrocephalus, speaking.
There are so many times that it's like I would feel that I'm messed up, even when I'm not messed up, because I've always been messed up. So I feel that, probably I'm messed, and I'll be checking around. So as I'm sitting in class, my mind is not there. I'm thinking about how people are feeling, whether they feel I'm smelling, whether they may smell, whether I'm urinated, whether the stool has come, what people are thinking, how are they feeling, what would they say, all of these things. So my whole life and the whole education was mostly for these stories and how people were thinking about me. And trust me, I had a very low self-esteem. Like, I had a very low self-esteem. Even talking right now is by grace, because I had a very low self-esteem. I felt probably, this is my fate. I cannot and I will never amount to anything. My life is just stuck to this. This is me. Like, nothing can be done about it. I cannot have a life. And all these things were affecting me. And I always wanted to just end it. I remember when I just completed my HND in 2020. I just wanted to end it all, because it was too much. It was just too much, because of the excess urine. I have to be wearing diapers every day, and the money that has gone into buying of diapers, my mom will say it can be used to build a house, because the money is too much being wasted in just Pampers, and it's embarrassing, it's hurting, it's frustrating. Every day I'm wet, every day I am in a mess, every day the place is smelly, and I sit in Uber cars, I'm wet in the cars. Wherever I pass, I'm getting wet. I don't know what to do. In fact, there's one time I don't want to go to work because just knowing that I'll go and come back with wet alone was disturbing.
This kind of disability is very, very challenging. You as a mother, you need to be alert, very alert. Just as I was telling you, you will be playing with her. In another moment, her condition will change. It was so traumatizing, so disturbing, so frustrating, and at a point, it was affecting my work. At that time, I was a head teacher. So you could imagine a head teacher who had been out of school for 3 months. I mean, it was better for them to take the headship from my hands. Well, they didn't anyway. And financially also, anytime we were paid, the money will just flow out of our hands because Dorcas will be sick and we had to use the money on her. So it even affected the family resources. Even the food to eat was a challenge. But we had extended family supporting in one way or the other. And that kept us going.
In Ghana, children with Spina Bifida and Hydrocephalus hardly cross age 15. While some of them die due to complications or inability of their parents to afford the cost of managing the condition, it is also believed that some of the parents themselves get rid of their children to save themselves from the stress of dealing with such a difficult situation. And so, until her demise on November 15, 2022, Dorcas Margaret Madjikie was considered the oldest Ghanaian with Spina Bifida and Hydrocephalus.
But then sometimes I think the parents get frustrated. It's very difficult taking care of them, especially when you have an hydrocephalus child with a head of about 60 centimeters. It's too big. You are not going to work, and nobody is going to take this child for you to go and work. So it means your life is at a halt. You have to stay home and take care of this child. And that's what we hear. They say some abandon the children, some take them to the bush, leave them for them to die. Some are also kept in rooms, so you don't see them outside. And the treatment is quite also expensive. So if you don't have money, then it's a problem. If the support is not there, then it's a problem. The condition itself doesn't kill, unless there's an infection or something. The condition itself, when managed well, you live, but it's difficult to take care of it.
In the course of putting this documentary together, Dorcas was hospitalized a few times as a result of infections and other complications, and that eventually led to her demise. This is indeed a troubling condition, but the refreshing news is that it can't be prevented to a very large extent. Yes, you heard right. If couples, especially the women, would take precaution, they would be saving themselves, their children, and society in general from this frustrating and traumatizing condition.
First of all, because there are predisposing factors. As I mentioned, the factors, some are nutritional, some are environmental, some are also genetic. It's difficult to control the genetic factor. If you have a family of children with spina bifida or hydrocephalus, you may run a risk of having one. If it's genetic, it's in your family, then when you have to get pregnant, you have to talk to your doctor. He may give you the Folic to prepare your womb very well, so that in the formation of the neural tube, you don't have any defects. But then it's not guaranteed anyway, but then it reduces the risk of you having such a child. And then if you have diabetes, you need to be well controlled. So when you go to the hospital, they ask you of any disease. Tell the doctor everything. It's for a purpose that he asks all the conditions you have, so that he will control it for you before you get pregnant. But then if you have infections, that means when you get pregnant, you should always see your doctor. Control any form of ailments you have. When you have vaginal discharge, it's not a crime. It may be an infection. You have to talk to your doctor. If you are taking any drugs, as I mentioned, the anticonvulsants, you have to talk to your doctor. Tell him all the drugs you have. Those which are going to affect the pregnancy, he will tell you to stop them, or maybe give you a substitute. And then trauma, injuring your head also causes hydro, so you have to take care of yourself. There are some accidents you cannot prevent, but especially in children, we have to take good care of them, make sure they don't come into any form of accidents causing trauma to their heads. If you know you have a baby or a child, clear your hall so that the child can play with things that are not dangerous.
If women and girls would commit themselves to taking a tablet of synthetic folic acid daily, they would be reducing up to 70% the chance of producing children with spina bifida and hydrocephalus.
And then research has also found out that folic acid prevents neural tube defects, that is spina bifida and the hydrocephalus. Folate is just vitamin B9, which is folic acid, the small tablets you take, the yellow one. It is found out and then it is documented that when you take this, you have a chance of preventing 70% of the risk of having a child with neural tube defects. This drug helps in the formation of the neural tube, but then you have to take it before you get pregnant. The term is before pregnancy. If you take it after 3 weeks, this tube we are talking about, it forms in 3 weeks of pregnancy. When the tube is forming before it gets to a child, by 3 weeks, the brain and the spinal cord are formed. And then if you are lacking anything or you are at risk of anything, then you are going to have a child with neural tube defect. But then when you take the folate before pregnancy, it prepares the place and then it helps in forming the neural tube, so you don't have any defects. Every female of childbearing age, as soon as the girl starts menstruating, the child can get pregnant. So you have to start taking folic acid, because you never know when you'll be pregnant. Even married people, can bear with me. They don't know when they get pregnant. So you start taking that tablet. The first time you start menstruating, you start taking it to prevent all these effects. 1 tablet a day till you finish giving birth to all your children. In fact, the vitamin in its natural form is folate. We have it in our foods. Legumes, we can look at beans, pea, vegetables, lots of them, fruits as well. Folate is vitamin B9. So banana also has it. So we can be eating all these things to give us the folate we need in our blood. But you can't be sure whether you have enough in your system. So you just have to supplement with the synthetic folic acid to make sure your blood is well fortified before you get pregnant. And it's very cheap. You walk to the pharmacy, just tell them you are buying folic acid. It comes in 5 milligrams. They'll give you 1 tablet a day. Whether you brush your teeth, whether you are eating, you can always take it. But it's best if you can put it on your sink or where your brush is. As soon as you put it in your mouth, you go and brush your teeth. And we are sure you will reduce the risk of having spina bifida child or hydrocephalus.
Yes. This is all it takes to escape or reduce the risk of experiencing such emotional and financial stress. Woman, young lady, you owe it a duty to yourself, your unborn children, and society as a whole to commit yourself to a daily intake of folic acid. And now to society and its attitude towards persons with disabilities. These are some of the many challenges persons with disabilities have got to battle with on a daily basis. They've got to maneuver through these difficulties while making efforts to attain their aspirations and live meaningful lives and contribute to the development of the country like every other citizen. Discrimination, stigmatization, or any other negative treatment is certainly not what you offer people fighting such battles. The least you can do is compliment their efforts. Do the little you can to make life easy for them. But if you can't, please do not add to their woes.
Acknowledgement. Redman's Foundation, Dorcas Margaret Foundation, Kolebu Teaching Hospital, Nana Brown Akwe, Dr. Patrick Banker.